Systemic sclerosis is a disease which can affect a number of organs, and we see the effects of systemic sclerosis most visibly on the skin. The effects that you can see of systemic sclerosis on the skin are happening in all parts of the gastrointestinal tract. In the gastrointestinal tract, we know that there's fibrosis in the submucosa, there's smooth muscle atrophy, and we also think as well that the little nerves that supply the gastrointestinal tract are also affected. And we think that's probably because the microvasculature of the nerves is affected in systemic sclerosis. The whole of the gastrointestinal tract can be affected in systemic sclerosis, from top to bottom. In the oropharynx, individuals suffer from dry mouth, problems with opening the mouth, microstomia, and can have dental problems associated with that. Going down to the esophagus, individuals have problems with swallowing, so dysphagia and a lot of dyspepsia. This is due to the fact that there's poor peristaltic wave and there are low pressures in the lower part of the esophagus. And this is picked up by esophageal manometry, and also on pH monitoring we know that there's a lot of reflux in these people who have systemic sclerosis. Now, since the advent of proton pump inhibitors, really the treatment of the gastrointestinal problems in systemic sclerosis has been revolutionised, and bearing in mind that some 80 to 90% of patients who have systemic sclerosis will have these symptoms in the gastrointestinal tract, particularly in the esophageal area. That if we can give our patients proton pump inhibitors, we know that we can eradicate these esophageal problems and improve their quality of life. However, when we're giving proton pump inhibitors, we know that we very often have to give at least double and sometimes even triple the normal doses of proton pump inhibitors to achieve success in treating the problem. Going on to the small bowel, we get stasis of the small bowel, as we do everywhere in the gastrointestinal tract in systemic sclerosis. As a result of that, you get bacterial overgrowth, and we know this from hydrogen breath tests. In individuals who do have this bacterial overgrowth, they suffer from bloating and very often diarrhea and steatorrhea due to the high fat content because of the bacterial overgrowth. And this can respond well to cyclical oral antibiotics. The large bowel can also be involved, and whereas some people can get diarrhea as a response to large gut stasis, most people have problems with constipation. Moving down the gastrointestinal tract, systemic sclerosis patients can have problems with anorectal tone, and not infrequently patients with systemic sclerosis can have problems with fecal incontinence, and this is an under-recognised problem.